CNA Suicidal Patient Protocol. Welcome to the quiz. Question 1. You are working the day shift when you observe something concerning. While helping a different patient, you overhear a nursing assistant on your unit speaking harshly to a patient, using disrespectful language, and treating the patient in a way that is clearly disrespectful and unkind. The patient appears upset and distressed by the interaction. The patient has asked you not to report the incident, saying they do not want to make trouble. However, you believe this behavior is inappropriate and potentially harmful. Based on your responsibility to advocate for patients and maintain professional standards, how should you handle this situation? Option A. Say nothing about the incident to anyone, respecting the patient's request to remain quiet even though you witnessed inappropriate behavior. Option B. Only report the incident to other nursing assistants during your lunch break, but do not tell any supervisory staff or the charge nurse. Option C. Report the incident to your supervisor or charge nurse so that it can be documented and addressed through appropriate channels, as this is your responsibility. Option D. Confront the staff member immediately in front of the patient and other staff members, and tell them that their behavior is unacceptable. The answer is C. Patient abuse or disrespect must be reported, even if the patient asks you not to. Option C is correct. Option A allows harm to continue. Option B is gossip, not proper reporting. Option D, confronting the staff member publicly can escalate the situation and is not the proper chain of command. Question 2. You are assisting with hygiene care for Mrs. Nancy Foster, a 65-year-old female patient. The nursing staff are emphasizing the importance of comprehensive hygiene care and its role in overall patient health and well-being. When considering the purposes and goals of providing comprehensive patient hygiene care, which statement most accurately describes the primary goals of hygiene care? Option A. The main goal of hygiene care is to punish patients for being ill by forcing them to bathe even if they do not want to. Option B. The primary goals are to maintain cleanliness, prevent infection, promote comfort and relaxation, provide an opportunity to assess the skin, and maintain the patient's dignity and sense of well-being. Option C. The main purpose of hygiene care is to follow the hospital schedule exactly regardless of patient preference or individual needs. Option D. The primary goal is to make the patient tired so that they will sleep for extended periods and require less care. The answer is B. Hygiene care promotes cleanliness, infection prevention, comfort, skin assessment, and dignity. Option B is correct. Options A, C, and D are incorrect and disrespectful. Question 3. You are assisting Mr. Christopher Wilson, a 70-year-old patient, with eating his lunch. As you observe him eating, you notice he is having some difficulty with chewing, seems to be taking very small amounts of food, and is chewing very slowly and carefully. He mentions that swallowing seems difficult sometimes. You are concerned about his ability to swallow safely. When assisting a patient with eating, which observation is most important to report to the nurse? Option A. How much the patient actually likes the taste of the food on his plate, or whether he thinks the food is good. Option B. The color and appearance of the food on the plate and whether the portions are an appropriate size. Option C. Any difficulty with chewing, swallowing, or signs that could indicate aspiration risk or difficulty managing food. Option D. Whether the patient finishes all of his entire meal or leaves food on his plate. The answer is C. Difficulty chewing or swallowing is a critical observation that may indicate dysphagia and aspiration risk. Option C is correct. Taste, food appearance, and meal completion are not urgent safety issues. Question 4. During an educational session on patient confidentiality and HIPAA, your facility's compliance officer is discussing patient privacy and what constitutes appropriate versus inappropriate handling of patient information. She is providing examples of situations and asking staff to identify which would be appropriate. Based on standards for maintaining patient confidentiality and HIPAA regulations, which statement about patient confidentiality is accurate? Option A, you may discuss a patient's medical information openly with anyone who asks, because patient information is considered public information once the patient is in the hospital. Option B, you may share detailed patient information with family members without asking the patient's permission, since family members need to know everything about their relative's care. Option C, all patient information must be kept confidential and should not be discussed unnecessarily with anyone who does not have a medical need to know the information. Option D, you may discuss patient information in public areas of the hospital, such as hallways or elevators, if you speak quietly so other people will not overhear. The answer is C. HIPAA mandates that patient information is confidential and only shared with those who have a need to know. Option C is correct. Options A, B, and D are violations of confidentiality. Question 5. You're assisting Mrs. Linda Adams, a 70-year-old female patient who has just received news that her cancer has progressed and her condition is becoming terminal. She is lying in her bed with tears streaming down her face, and she is clearly emotionally distressed and grieving about her situation. You want to respond to her in a compassionate way. Based on best practices for responding to patients who are experiencing emotional distress, crying, or grief, how should you respond? Option A, leave the patient alone immediately and avoid her, as her emotional distress makes you uncomfortable. Option B, tell the patient to stop crying and that everything will be okay even though you know her condition is serious. Option C, listen with empathy and compassion, offer comfort through physical presence and supportive gestures, acknowledge her feelings, and notify the nurse so that appropriate support can be provided. Option D, change the subject abruptly to distract her from her emotions and try to make her think about something more positive. The answer is C. When a patient is grieving, empathetic listening and presence are key. Option C is correct. Options A, B, and D dismiss the patient's feelings and are not supportive. Question 6. You are reviewing infection control and the proper use of personal protective equipment, PP, during your training. The instructor is explaining the multiple purposes that PP serves in healthcare settings. Based on understanding of infection control principles and the purpose of using PP, what is the primary purpose of using personal protective equipment in healthcare? Option A, PP is used mainly to make patients feel protected and reassured, even if it does not actually prevent infection transmission. Option B, PP is used to protect you, the patient, and others from transmission of infectious agents from blood and body fluids. Option C, PP is used only to follow hospital rules and policies without any actual practical benefit for infection prevention. Option D, PP is used to limit the amount of time you have to spend directly interacting with patients. The answer is B. The primary purpose of PP is to prevent transmission of infectious agents, protecting both healthcare workers and patients. Option B is correct. Options A, C, and D are incorrect. Great job! Don't forget to subscribe. Bye!